Spread of measles, which is accelerating in the United States. According to a report by the Federal Centers for Disease Control and Prevention, the number of cases is now up to 465. New York City's health commissioner signed actually a mandatory vaccination order this week, requiring more than 200,000 people who live and work in Williamsburg, Brooklyn, who don't have evidence of immunity, to be vaccinated within 48 hours. The move is the first time the city's imposed such mandatory vaccinations.
And joining us now, author, surgeon, and Morning Joe medical contributor, Dr. Dave Campbell. First of all, this sort of enforcement that's happening in New York, is that something I've missed? I've never heard of something like that happening. And secondly, what can parents do? Is there anything else they can do to prevent this being spread on beyond the vaccination?
Yeah, it's a bold move by Mayor de Blasio, which is appropriate, and it's directed toward this very highly contagious disease that it's easy to forget about, because in 1963, when the vaccine came out, the numbers went down dramatically. So most of us, I'm 60, that's back in the old days. It's a highly contagious disease, and keeping people that are infected away from other people that are not infected and not immunized is key, and that's the way to prevent it.
So if let's say your kid does get measles, obviously you have a lot of side effects. Diarrhea is especially dangerous. I understand there's a home remedy that actually public health officials are suggesting if your child gets measles. What is it?
There is. First, it's Gatorade and Pedialyte. But if you have a flat tire or you can't get out of the house, you can make your own oral replacement salt. A liter of water, 6 teaspoons of of sugar, and a half a teaspoon of salt. Mix it together, maybe some orange juice, and give it to the kid to help the dehydration caused by diarrhea. That's one of the leading causes for really severe side effects from measles.
So Dave, Williamsburg and Brooklyn is a highly compact area. What do you do if you have a child, say between the ages of birth and 2 or 3 years of age, who have already received some sort of vaccinations against things? Would that child be impacted by being close in a highly congested area to people with measles?
Well, they could, because the vaccines are about 97% effective. That leaves that dangerous 3%. And there are some kids out there who haven't been vaccinated because of health problems, immune suppression. And then, of course, the pool that aren't vaccinated at all. So you're not totally protected by having the vaccine, but it's a critically important thing to do to protect everybody.
That's what you say about flu shots as well, right? That the flu shot may not help you individually one season, but it helps the entire population.
Yeah, that's the herd immunity concept, and it's critical, because the more people are vaccinated against these infectious communicable diseases, the less likely somebody that for whatever reason is not vaccinated will catch the disease. Critically important.
All right, we'll be following this measles outbreak.
Yeah, and Doctor, I just hope that you realize the medical profession has a huge role here in stepping up and talking about the safety of vaccinations. This misinformation is really dangerous.
Yeah. No, every doctor in the country knows that, and they're today talking to their patients about what to do for themselves and their families to get vaccinated. It's not just measles. There's mumps, there's rubella. There are adult diseases out there that need vaccination. So vaccinations in general are important.
All right, Dr. Dave Campbell will stay on this, and thanks very much for being on this morning.
Thank you, Dr. Dave.